Welcome to our nursing physical assessment quiz. Let's put your knowledge to the test. In today's challenge, we're covering 4 essential areas of the physical assessment: head-to-toe assessment, abdominal, respiratory, and cardiovascular assessment. There are 3 questions per topic, 1 easy, 1 medium, and 1 hard, worth 1, 2, or 3 stars. After each question, we'll give you a moment to think and then we'll reveal the correct answer, along with a quick explanation. Ready? Let's dive in. What should the nurse do first before beginning a head-to-toe assessment?
We do before we start our assessment is when I enter into the patient's room and before I start assessing from head to toe, make sure you introduce yourself. And it could just look something like this. Hi, I'm Samantha. I'm going to be your nurse today. Can you go ahead and give me your name and date of birth?
Brandon,
Okay.
March 7th.
Okay, perfect.
What would be considered a full set of vital signs?
So this would be a great time to go ahead and get a full set of vital signs. That's going to give us a really good indicator of his hemodynamic status. So I get a blood pressure, a heart rate, a respiratory rate, an oxygen saturation, as well as a temp. Now, if any of those are critical or abnormal, we want to make sure we report those.
Where should the nurse palpate for the Dorsalis Pedis pulse?
We want to check for pulses, and this is really important and a good thing to practice as a student. So we want to check, and if you kind of go between Brandon's big toe and his second toe, and just anytime we palpate, keep those flat, go down with about 2 or 3 fingers and palpate for what we call the dorsalis pedis and check for circulation. And again, anytime you're working down the body, if you've got 2 hands, you can assess at the same time. Now we're checking if it's thready or bounding, and we want to make sure absolutely that it's present.
What is the correct order for assessing the abdomen?
So here's the really important thing to remember is when we're talking about an abdomen, when we go to inspect, we can look, then we want to listen, then we want to percuss. Or palpate. What I mean by this is you don't want to go pushing on and around Brandon's abdomen, because when I go to listen, that can stir up those bowel sounds, and that's not his true natural bowel sounds that we need to assess.
Which percussion sound is expected over the right upper quadrant due to the liver?
So we're going to percuss the abdomen by gently tapping with our hands over different areas of the stomach. Really, we're just noting areas of dullness and tympany. So we may expect to hear a little bit of dullness over about the right upper quadrant of the patient's abdomen, because of course, this is where our liver is located.
A high-pitched, tinkling bowel sound similar to rainwater is most concerning for
Borborygmi is that stomach growling sound that would be characteristic of somebody who's hungry, versus the tinkling sound, a high-pitched sound of almost like rainwater would be concerning potentially for an ileus or small bowel obstruction.
Why should the nurse auscultate lung sounds on both the anterior and posterior chest?
So here's a really important point to note, and many times you're going to see nurses do this, but it's really important to listen to the front of our patient's chest, Brandon here, and also the back. Now we're going to do this because sometimes you can't catch stuff in the front, and you may indeed hear abnormalities in the back and the bases of your lungs. Now this is really important here because many times, like if you have a patient with pneumonia, for example, sometimes you can't hear abnormal lung sounds such as crackles in the front, but you can sure hear it down here in the bases, in the posterior or back side.
Which abnormal lung sounds should you listen for during auscultation?
Now, as you're listening to the lung sounds, listen for some abnormal sounds. You're listening for things like fine or coarse wheezes, crackles, rhonchi, or even an absence of sounds or diminished sounds.
A nurse notes that a patient who recently had abdominal surgery is breathing rapidly and shallowly while lying flat in bed. Which nursing intervention would best help improve this patient's breathing pattern based on factors that influence respirations?
The position of the body. Now, the best position to facilitate good breathing if someone who's having trouble is high followers. Have them sitting pretty close to straight up in bed. That will facilitate their ability to breathe.
Which heart rate range is considered normal for most adults at rest?
And of course, don't forget about the heart rate of your patient. As you recall, 60 to 100 is what we consider normal, but your patient's resting heart rate may be a little bit different. So it's important for you to assess it and note that first.
Which auscultation site is preferred for clearly hearing S1, S2, and heart murmurs?
However, the Erbs point that you see pointed out here is the auscultation location for heart sounds and heart murmurs, and this is really preferred. Now, as you can see, this is located between about the third intercostal space and the left lower sternal border. And now here at this Erbs point, you should be listening for the S1 and S2 here.
Which heart sound is commonly associated with heart failure and best heard with the bell of the stethoscope?
A few cardinal features can really help us. We already talked about the third heart sound, the S3, which again we're going to appreciate with the bell of the stethoscope in the left lateral decubitus position at the apex.
That's it for today's quiz. Count your stars and let us know how you did in the comments. Keep mastering those core PEDS concepts, and we'll see you next time.